it's extremely important we have access to healthcare. Unfortunately, Nigeria today, healthcare has become like gold. Access to healthcare is literally impossible for those who can't afford it.
Welcome back to Africa Science Focus, the science and development show from SciDevNet. I'm Ogechi Ekeanyao. You were just listening to Professor Chiso Ndukwu-Okafor, the Executive Director of the Consumer Advocacy and Empowerment Foundation. She spoke to our reporter, Royal Uche, about healthcare challenges in Nigeria. In Nigeria, healthcare is inaccessible for a number of reasons, including high costs and shortage of healthcare workers, as well as poor investment in the health sector. According to the National Primary Healthcare Development Agency, 6 out of 10 Nigerians lack access to quality healthcare. This situation exacerbates disease outbreaks and forces people to pay for their health expenses out of pocket. Chiso will provide further insights into the state of healthcare in Nigeria.
Even in the urban areas, there's at least the healthcare facilities are available. The issue is whether you can afford it or not. But in rural areas, the issue is compounded because one is access, because there's very few places have healthcare facilities that are functional. If the local governments are supposed to have health centers, but a lot of them are non-functional. And so access to healthcare is really a challenge. Health insurance, as we know it, is not easily accessible. It's expensive. With the poverty level in Nigeria, most people making less than 30,000 a year, with the exception of 2 states, Lagos State being one of them, there's health insurance they can't afford. My basic health insurance is 60,000 naira a year, and your salary is salary is 30,000, 60,000 a month, and your salary is 30,000. You see, it can't be viable. So, I remember hearing stories in those days, 60s and 70s, where we had general hospitals that were very functional, teaching hospitals that were very functional, and people could go to there, access these places and get proper health care. Today, even the general hospitals are not as functional as they used to be in the past. So it's not easy.
One organization dedicated to improving healthcare accessibility and affordability is the Atayese Health Network. It operates in rural and urban poor communities in the southwest region of Nigeria. Dr. Adeolu Olusodo, the founder, shares more about the organization.
Atayese Health Network, an organization that was set up to make sure healthcare is affordable and accessible. That's what we do.
How will you describe access to care in Nigeria?
Then if you look at our country, Nigeria, access to healthcare is a bit problematic because quite a number of people don't have access to healthcare. Even in the cities where you have hospitals here and there, you still find that people still have difficulty in getting to the required health personnel for them to be able to have access healthcare. There are 2 components to healthcare that we have. There's the financial access and also the functional access. And the financial access is the fact that the ability to be able to pay for services when required. That one is there. And the functional access is the fact that the closeness of the person to a health facility where you have qualified health personnel to attend to them. So if you look at Nigeria as a whole, even in the cities, there's still a problem of access to healthcare for people.
Tell us about Atayese project and what states are covered.
In Nigeria, there is still the access to healthcare is not widespread, and a lot of people are denied access to quality healthcare. That is one. So then, about us in Atayese Health Network, when we found out this, one of the things we set out to do is to make healthcare accessible and affordable. You know, affordability is part of access, to make sure that people have access to a qualified medical practitioner, and at the same time also can be able to afford to pay for those services. And we set out from Lagos. That's where we start out from. And we started from Lagos. In Lagos, we moved to the suburbs in Ikorodu. After we left Ikorodu, we also moved from Ikorodu to Ogun State, in Ijebu, to be specific, Ijebu area, where we work in the suburbs and also in the rural areas. And we've also moved into Oyo State. We have somewhere on the outskirts of Ibadan town now, where we have a center that we used to go periodically to attend to the elderly people there. There is a time we went to Ilorin, and we're also in Oyo town, but presently we have to rest them because of logistics. It does not really favor us because of what we need to put in place. But presently we are in 2 states. We're in Lagos State and we are in Ogun State, attending to especially elderly people.
What motivated you into embarking on this project?
My motivation for doing this is basically my interest in ensuring that virtually everyone have access to healthcare, and everyone also is have access to quality life. You know, healthcare is very important. Also, there are other parts of life that we need to also ensure that people get the best of it, and we need to move out, especially to the suburbs and the rural areas, so that they can also enjoy what people in the cities are enjoying. And I can say vividly that Atayese Health Network have really helped in improving the health status of rural dwellers. Some of them have they have not been opportuned to see medical doctors. They now have access to a medical doctor regularly, and they also have access to quality health care when needed. We run 2 facilities in areas we can call rural areas in Ogun State, Ishoyin, and Odo-Shebora in Ijebu Northeast. And we have health workers on ground, and it's a facility that can admit people, and we can also run surgeries there. And we've done few surgeries in one of the centers. And one of the beauty of it is that even people have to come from Lagos. Because of their parents based in rural, they have to tell their children that we have a doctor, and people came from Lagos for surgical intervention in those centers. And it's part of those things that we've been doing. And we continue to see the smiles on the faces of these elderly people who probably will have to go as much as 15 miles, 10 miles for them to attend the clinic to manage their hypertension, to manage their diabetes, to even manage their arthritis and stuff like that. And they don't have to go that far again. They have the healthcare delivery at their doorstep. Because apart from the clinics we run, we also do mobile clinics. We take to communities. We have a team that goes from one community to another. So these are the things that we have been doing.
How are you getting your funding?
Funding it has been difficult, but what we have done is to ensure that we bring all these beneficiaries into a health club. We run it more like a group health cooperative, where everybody pays a monthly fee. That monthly fee, we pull it together, at least we'll be able to cover some of our expenses. Then we have people supporting us that, of course, they like what we are doing, and one way or the other, they support by paying for treatment for some of these people. And some of the people we have on free treatment, the free treatment is being sponsored by our partners, people that love what we are doing. But that does not still stop us from ensuring that all these beneficiaries are pulled into a health club, and they pay as small as 300 naira per month. If we move away from the rural area, we move to the towns. Some pay 500 naira, and those that are in the big towns in the cities, they pay 1,000 naira per month. So they're able to have access to free consultation, free tests. We run their screening, their BP, sugar tests, all those ones come freely. And also they have access to subsidized drugs. So they don't have to spend as much as others are spending on drugs for the things that they do. So those are the things that we do. So our initiative, apart from those on free treatment, people still have to pay for their drugs at subsidized rates, and also to pay for little things like small tests, the tests they do that are not the sugar test and the BP that we do for them. Every other test, they just pay something small. We don't really mark up as we do if we really want to treat them in a competitive way. And these things we have been doing in the last 10 years. We started this Atayese Health Network in 2013, and on October 1st, 2013, and we started running our clinics from October 8th, and we have been doing this thing for 10 years, and it has been good.
And what are the challenges you have encountered in the process of implementing this program?
It's so challenging because many times we won't have funds to run our programs. The challenge has always been funding. When we started, actually, people were not paying a dime to access healthcare. We started with about 50 elderly people. They were just getting all their drugs free, getting consultation free, and they only pay 200 naira as membership fee then. Then because of issues of the economy, then we had to introduce fees as at 2016, they had to start paying for drugs, but we still subsidize it for them. And we have been having the challenge of funding, but we thank God we have been able to overcome it one way or the other through the help of our partners.
The factors contributing to Nigeria's healthcare challenges are multifaceted. Dr. Emeka Orji, president of the Nigerian Association of Resident Doctors, sheds light on some of the underlying reasons.
The issue of access to healthcare in Nigeria, especially in rural communities, is a topical one. It is very important that we discuss it, because we know that the majority of Nigerians reside in rural areas, and so they do not have access. They do not have as much access to healthcare as those living in the cities. And over the years, we have not seen any remarkable effort on the part of government and other stakeholders to change the trend, to change the narrative. In fact, this access to healthcare is even getting worse, even for those in the cities, because of this massive brain drain we are currently having in the health sector. We have been on this for some years now, trying to draw the attention of government and other stakeholders to this trend, And we have also highlighted the major cause of this brain drain in the health sector. Doctors and nurses are leaving in their numbers, and that is because of the poor remuneration that they are getting. There has not been any significant increase or upper review of the salary structure of both doctors and nurses in the last 10 to 13 years. And ever since then, we've been having skyrocketing inflation, increase in exchange rate, fuel price. If you check the differential between 2009 and 2023, 2009 was when the current salary structure was approved. That's the consolidated medical salary structure. And if you check the differentials of those parameters I talked about with the figures in 2023 this year, we will realize that there is a massive decline in the purchasing ability of doctors and nurses, going by the salary structure. And so much as we are patriots, we want to serve our country, we want to treat Nigerians, we want to take care of their health needs. If you are doing that, and you are not also able to take care of yourselves and your families, and you see a better opportunity elsewhere, it is tempting, and there's no way you will not want to go there and try to exploit or try to capitalize on the better working condition outside there to take care of yourselves and your families.
What do you think government can do to improve access to health care?
What government has to do is to just like we have identified the major cause of this brain drain, okay, to start with, even without brain drain, we don't even have enough. And so there has to be an effort to increase the production capacity of our training institutions, so that many doctors or more and more doctors will be produced yearly to join the system. Nigeria, at the last count, produces around 3,000 doctors yearly, annually. And so, obviously, that is not enough. And so there has to be a way of increasing either the carrying capacity of the medical schools and also establishing new ones, so that we can significantly increase the production rate every year, so that you have more people joining the system. That will obviously require investment in the health education sector. The other thing that has to be done is to now identify, just like we have done, the major cause of this brain drain. Because if you don't arrest the massive exodus, no matter the number you produce, all of them will eventually still leave the country and go outside in search of greener pastures. So there has to be a very clear effort, tangible effort to massively improve on remuneration, improve on incentives and other welfare packages for doctors and nurses, so that, of course, we are not even saying that we should be paid like they pay in Europe and America, because we know that Nigeria cannot afford this. But it is part of fortunate that even in African countries, nearby African countries, they treat their doctors and nurses better than they do in Nigeria. They pay them better. And these are countries that Nigeria has better economic status, better means of getting resources than them. And so if they're able to do that, and Nigerian doctors are going there, African countries, there's no reason why Nigeria should not be able to do better. And so that's what we are talking about. And of course, they also have to improve on the infrastructure and on the equipment. There has to be massive investment in the health sector. And they need to start by improving the annual budgetary allocation to health. We know that the Abuja Declaration of 2001, where heads of state of African continent gathered in Abuja and agreed that for any country to make any significant impact in the health sector, they need to budget minimum of 15% annually to it. Ever since then, Nigeria has never met that resolution. In fact, the current budget to 2023, the percentage to health is less than 7%. And so if you keep on the budgeting to health sector, you're not going to have enough resources to improve on infrastructure, to improve on personnel, to improve on remuneration. And so Nigeria has got to look into that, and like I said, improve budgetary allocation to health, also improve budgetary allocation to education sector, because it's when you do that they have enough resources to establish more medical schools and then produce more medical graduates. And so, and even when they do that, effort should be made to monitor how the funds are being expended so that it doesn't get immersed in corruption. This is very important.
How can philanthropists, NGOs like Atayese come in to complement the efforts of government?
I believe that the non-governmental organizations and the philanthropists should also help, because I do not know of any country that health sector investment only comes from the government. Of course, the government has got to create an enabling environment for private bodies, non-governmental organizations, philanthropists to come in and invest. It's the same government that will create that enabling environment. And so we believe that NGOs should help. Of course, just like it happened during the COVID period, where we have the COVID massively supporting the effort of government in the supplies of medical consumables and indeed other materials needed to combat the raging COVID-19 pandemic as at then. And so it shouldn't just be because of that emergency. There has to be a way of encouraging, and appealing to well-to-do individuals, companies, non-governmental organizations, private sector, to come in and invest in health sector, by way of establishing health institutions, training institutions, and again, when they do this, government has got to benchmark there has to be a benchmark as to what the standard should be in terms of equipment, in terms of location, in terms of personnel, in terms of remuneration. And so, because what actually happens is that when they come in and they want to start paying, they just look at what the federal government is paying and start paying exactly the same, or so they don't even pay lower. And so government has got to set the pace for these private individuals to emulate.
These issues pose significant problems. What actions can the Nigerian government take to address them? Let's return to Chiso for further discussion.
So what can government do to improve access to healthcare? The government can do a lot. First, they have to have policies that, one, encourages healthcare centers, hospitals to be established Two, they also have to be able to monitor those that exist. The monitoring and evaluation of existing private healthcare facilities is very minimal. As such, even when you have access to healthcare, the quality of care you're getting and the consistency of care you're getting is abysmal. I've noticed that often deaths are underreported, errors in judgment or in healthcare is underreported. People don't know that they are supposed to have questions answered if something is going wrong. In the healthcare system, FCCPC, Federal Consumer Competition and Consumer Protection Council, tells you have a right to ask questions about your health. You have a right to know the medication you're taking. You have a right to say no to a doctor if you don't feel comfortable with the services they're offering. People don't know their rights, their healthcare rights, even when they have access to healthcare. So the government should do more in monitoring and evaluation existing healthcare. Education, preventative education processes needs to be more information and awareness. There's so much fake information. Do this if you have a headache. Do that or do that. And so people are even self-treating themselves because of lack of education. So government can do more through their policies, through investment in health centers, through monitoring and evaluation of existing healthcare facilities. I do understand that government can do it all. And so we know we have philanthropists, we have NGOs that actually do a lot. We have churches and mosques that do medical missions. We have philanthropists that have foundations that pay hospital bills. We have NGOs like Atayese that comes and offer free care, healthcare services in different rural areas to disadvantaged groups. And that is commendable, extremely commendable. But for a country such as Nigeria with over 200 million or up to 200 million in population, more still needs to be done. Make it easy for NGOs and philanthropists to come in and support the activities, healthcare activities, and support the government. Often I've had people who would contact me and say, oh, we want to offer some free care from different countries, doctors and nurses. So if there was a system that was set in place that will make it easy for visiting physicians and visiting healthcare personnel as well as hospitals to bring access of healthcare to the people, to bring it to the rural areas, to make it safe even for the healthcare practitioners to go into the rural areas, then it will go a long way. They said if you're healthy, then you can worry about other things around you. But if you're not healthy, there's very limited things you can do for yourself. So healthcare, preventative healthcare, and proper healthcare is extremely important in bringing wholeness and wellness into the lives of our people in Nigeria.
That's all for today's Africa Science Focus episode. For more information, visit the SciDevNet website at www.scidev.net. Today's show was produced by Alice Hurst, with editing by Ogechi Ekeanyawo and reporting by Royal Uche. I'm Ogechi Ekeanyawo. Until next time, goodbye. This project was funded by the European Journalism Centre through the Solutions Journalism Accelerator. The fund is supported by the Bill and Melinda Gates Foundation. If you have comments, questions, or feedback about our podcast episodes, please email us at podcast@scidev.net. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station.